and it's on the left left ventricle is the apex, right? Apex right there. And then the coverings, so the layers of the heart are going to be as follows. The outside part here, that's the epicardium out there. So we'll kind of look at a cross-section here. And then the middle part, the very muscular part, is the myocardium here. And then the layer that comes in contact with blood in the chambers, so everything that's within each chamber that touches blood is called the endocardium. That's deeper to the myocardium. And then we have the intraventricular septum, and that one is on both sides. You can see it as this thick piece of myocardium on this side, and also thick piece of myocardium on this side that separates the ventricles from the atrium, and well, the two ventricles from each other on each side, and the two atria from each side. So you kind of flip it up over here. There's that septum here. Basically separates the left side of the heart from the right side of the heart. In there, that's this big, thick, meaty portion right here is the intraventricular septum. And I've cut this longitudinally, so you know it's going to be the same on this side. Intraventricular septum here. Yeah. Intraventricular septum. Oh, interventricular septum, which makes sense because it's inter means in between to interventricular septum. Interventricular septum.
So this should be the right side, right? Because it's thinner.
Yes.
Okay.
Yes, very good. And so from here, I think I'm just going to work from this side. So we're going to have the right atrium is going to be this little chamber up here, and the blood enters in here through the inferior and superior vena cavas, and it enters in here through this valve. Oh no, wait, not through that valve. Through the inferior and superior vena cavas. And then the blood goes from this right atrium, flows through the tricuspid valve here into the right ventricle. All right, and the tricuspid valve, the structure of the tricuspid valve is kind of very delicate, but anchored by these little structures right here, these little white fine hair-like structures. They're called chordae tendineae. So that's what these little fine white fibrous structures are here. They're called chordae tendineae. And the chordae tendineae are anchored by what are called papillary muscles. So the papillary muscles are kind of the root of the chordae tendineae. See, look up in here. You can see it better on this side, so I'm just going to show you on this side. So see this little muscular place right here, papillary muscles. All right, and they anchor the chordae tendineae.
What's the chordae tendineae again?
They're those little white strings, and these little white strings are kind of anchors for the valves in the heart. So in this case we have...
So which one's the valve there?
So this is the tricuspid valve, and blood flows from the right atrium through the tricuspid valve into the left atrium. Ventricle, yeah, into the left ventricle. And then blood flows from the left ventricle through this pulmonary semilunar valve in here. It flows out through this pulmonary semilunar valve, through the pulmonary arteries over to the lungs. And from there, the blood diffuses through the lungs and through the, all those different branchings of all those different branchings of bronchioles until you get to the respiratory bronchioles. All the blood gets oxygenated, through the capillaries, the pulmonary capillaries that are around those respiratory bronchioles, and it's all full of blood, and it comes back in through the pulmonary veins, the only veins that have oxygenated blood. Why? Because by definition, a vein carries blood to the heart. So it goes through those pulmonary veins into the left atrium, which is this chamber up in here. It goes through the left atrium, and the blood comes through this left atrium and goes down through the bicuspid valve here. This bicuspid valve is also called the mitral valve. And so this bicuspid valve, here is again anchored by chordae tendineae. The chordae tendineae is anchored by the papillary muscles. And just a little bit deep to the papillary muscles, underneath here is what's called trabeculae carneae. It's the tissue that kind of looks like, I've heard Dr. Lee describe it as carne asada. It's a very meaty tissue that is deep to those papillary muscles in here. Trabeculae carneae.
Trabeculae carneae is in the left ventricle?
It's in
From the
both
left
ventricles.
Okay.
Yeah.
It's lower than the chordae tendineae.
Yeah, so it's deep to the papillary muscles. So you have papillary muscles that anchor those mitral valves, or those cuspid valves. And then the chordae tendineae are in turn anchored by the papillary muscles here. And just deep to the papillary muscles, or, well, I guess it's not less deep, but just towards, just after that, when you're getting into the myocardium, the edge of the myocardium is made up of this trabeculae carneae. It's like a carne asada kind of muscle in there. Trabeculae carneae. So the blood is here in this left ventricle, and it pumps back up through this aortic semilunar valve. So that's up in this region up here. And the aortic semilunar valve it goes out here through the aorta. And the aorta, you have the aortic arch and the ascending aorta and the descending aorta. And that's kind of where that flows out through there. So on a test, what I would probably do is put a little arrow pointing into there and ask, kind of a more specific question, like what is the name of this valve that connects the aorta to the aorta, or what is this? So this valve at the identify the valve at the tip of the arrow, something like that, because it's kind of up in there. And if you guys get confused, just raise your hand and I'll kind of point to what I'm talking about. But in this case, it'll be a little bit more of a detailed question than identify structure A, identify structure B. If I want to know if it's a valve, I'll say identify valve. If I want to know, identify the layer of the heart, that A is pointing to, I'll say that. What is the name of this layer of the heart? Identify the structure at the tip of arrow A, the white stringy things. Something like that. That'll be a little more descriptive, because I know there's a lot of stuff all together here. Any questions?
Trabeculae carneae.
Yeah.
Like, they don't have white strings, do they?
No, it's